Welcome to the International College of Dentists, the Chronicles with Outstanding Leaders in Dentistry. It's a project of the USA Division. And I'm delighted to have with me here in the studio Dr. David A. Whiston, who is a visionary leader in dentistry and a past president of the American Dental Association. Dr. Whiston also is an oral and maxillofacial surgeon who has seen all aspects of dentistry, the private practice, the hospital dentistry practice, and he's looked and worked in the interface between dentistry and medicine for most of his career. Welcome to this very special program. We're delighted to have you here.
Oh, thank you very much. Thank you for those kind words.
Well, thank you. We're here to sort of learn about what your leadership style is all about and to follow the story of your pathway in dentistry and in your personal life and how the two have sort of been interwoven over the years. And so it's, I think, always good to start at the very beginning. I understand you were born in Morgantown, West Virginia.
Yes. Yeah. Started out there, grew up in Morgantown, and went to school there, and we can develop that as we go along, but eventually drifted down to Northern Virginia, and my wife Julie and I live in Arlington, Virginia now. Still have family in Morgantown, but we live in Arlington, and we have children and grandchildren, and we see a lot of both of those groups, not too much, but we see a lot of them, and enjoy family certainly, but we both work and we're both pretty busy. So I would say we're probably busier with personal tasks rather than a lot of family activities at this point, but I'm sure that'll change as time goes on.
Well, I think there's always that kind of balance, as they say, that's important. I know that in my lifetime and all of our lifetimes, there are sort of people that have really made a difference, and especially during the young years and the adolescent years. Are there some people that sort of come readily to mind that made a difference in your growing up years?
Well, as I mentioned, in the Morgantown, West Virginia connection, and you remember those times, and certainly we have a great affinity still for Morgantown and get back there frequently to see family. And I'd say family's been the greatest influence. As time went on, I went to undergraduate school there at West Virginia University. I had a friend who was an oral surgeon, as they were described at that time, and perhaps if he had been an architect, maybe I'd been an architect, but he wasn't, and so I followed in his footsteps, and that was probably a turning point in my life. I didn't have a particular drive or desire to be a dentist, to be in the healthcare field in general. When I was in, well, actually, from a fairly early age, and then through junior high and high school, and early college years also, I was more interested in music and played in bands and did that sort of thing.
What instrument did you play?
Be described as keyboards at this time, but piano and organ then, and tried to not entirely have it be years of misspent youth, but they were enjoyable years. And again, as I said, at that time I had no particular interest in healthcare, but we change and things evolve, and as I say, I went to undergraduate school in Morgantown and had that friend who happened to be an oral surgeon. That probably started me on that pathway.
Well, was it during your undergraduate years that you had the friend that was already an oral surgeon? Did you need some oral surgery yourself?
No, actually it started, in fact, I had a very astute advisor in undergraduate school, and he felt that since music seemed to consume probably the greater part of my life at that time, he thought that dentistry and music would be a good mix. The hours would be better, I could do both, and of course I sabotaged that by going into oral surgery. I didn't really get on the surgical track until I got to dental school.
But in dental school, then you were able to see the full range of specialty options in the general practice, so you still persevered during that time in terms of looking at oral and maxillofacial surgery?
Yes, I did, and I think I just got caught up in the excitement of it by being around the specialty during those years, and felt it would be a good use of the interest I had at that time. And my interest in dental school turned more toward anatomy and physiology and pharmacology, and so the fit seemed to be a little more natural from that time on.
Well, actually, it's an interesting thing that you were advised by your counselor in terms of music and science, because now they're showing that the two are very well linked in terms of how one perceives and pursues those careers.
Right, and it probably fits in with a lot of things that we know but don't understand, and as time goes on we finally do understand some of the things we knew at an earlier time, but I think you're certainly right about that. Yeah.
Well, I've had a chance to visit the University of West Virginia, and I would think it would be lovely to have been there for the 8 years for both undergraduate and to dental school. It's just a lovely setting.
It is, and certainly when we look back on those things, we tend to remember the good, and education is education. When you're in school, you probably don't appreciate things to the degree that we appreciate them now, because now we certainly think that it was a great place to be.
Well, any highlights of dental school at that time?
Dental school, really, I think my experience is probably similar to most who went through professional school at that time, mainly trying to keep your eye on the finish line, probably not as diligent about paying attention to education for its own sake at that time, really more interested in doing what had to be done to accomplish the goal. And again, looking back on it, would you do it differently? Probably so, but as we all evolve, personally, we realize some of those things later in life that we should have maybe realized earlier in life.
But I think it's an issue of there's sort of that continuous learning that happens, so you sort of are always able to go back if you want to, but not with the luxury of time.
I mean, I think you're right. I think if you get in the habit of learning and the habit of education, then those habits are not easy to break either. And so when you come to the present day, at least in personal terms, my interests now would certainly still be music and sports and things like that, but also reading and education and learning.
Are you still playing music?
Only for personal therapy.
Piano?
Yes, yeah. That was, we moved into a different house in Arlington about 6 years ago. That was our first big purchase, was a new piano.
A grand piano.
Baby grand.
Baby grand.
Baby grand.
They're beautiful.
Yeah, really are.
And what about sports? What sports did you play?
Well, growing up in West Virginia, there was not a lot of esoterica when it came to sports. It was sort of what we called the big three: basketball, baseball, and football, and that sort of thing. But now, obviously, again, you evolve and grow out of those things, but started playing tennis, well, I was over 30 before I'd held a tennis racket, and so that certainly circumscribes your ability to achieve a lot on the tennis court, but like to play tennis, like to stay active physically.
Good.
Yeah.
Well, you left West Virginia and you went to Texas first?
Right.
For your specialty training?
Yes, undergraduate in dental school in Morgantown.
Right.
And then after dental school, went down to the University of Texas Medical Branch, which is in Galveston, Texas. Was there for a couple of years. A great place to be from a training standpoint, just a wealth of clinical material in Galveston. The didactic emphasis at that time was not what I'd hoped it would be, and although it is now, and they have a great program at the University of Texas Medical Branch in Galveston, but I left there because of that and went on to the University of Pennsylvania to hopefully improve at least my interpretation of the didactic part of our specialty to prepare for board examinations and things like that. So I went to the University of Pennsylvania. And you finished your last 3 years there, or 2 years? No, at Penn it was just about a year, really. It was strictly didactic at that time. So the University of Texas for part of the internship and residency, then University of Pennsylvania, and then just kind of drifted to Northern Virginia after finishing at Penn. Well, I'll tell you, it's sort of as you made that sweep around the country, but obviously the didactic aspects, as you mentioned earlier, in terms of your undergraduate and dental school training and then the specialty training are very important to you. Yes. And it's something that we have to assess every day in terms of continuing education and what we pursue.
What are your thoughts on some of the areas that we need to keep up with in the profession of dentistry?
Well, and certainly, and you know, obviously dentistry is a great place to be now, and that's one of the reasons, because of the just exploding technology. I'm sure that the half-life of dental knowledge now is probably maybe 3 years. I don't know what it is exactly, but I'm sure that the point is, I'm sure that that is shrinking all the time. So there's really no choice but to be a continuous student if you're going to have some semblance of current competence, and obviously we all have to be competent on an ongoing basis. I think the days, as they should be, the days are over that we can graduate from a professional school and say that's it from an educational standpoint. For instance, my specialty, oral maxillofacial surgery that you mentioned, has mandatory recertification to be a diplomat of the American Board. And interestingly enough, I hear that described today, rather than being described as recertification, the discussion is about maintenance of certification. That's probably a good way to describe it, because if we're going to maintain current competence, we have to demonstrate that we're doing that in some way. And again, the reason is to protect the public, and in the final analysis, that's our reason for being here, is to carry out good patient care. You know.
Well, I mean, I think I like your point about the 3 years time period or some time period, because things are moving so quickly. And part of it has to do with also our ability to assess ourselves. So having the guidelines that emerge either from specialties or from general practice that give you a sense of the periodicity of review is really important. Well,
I certainly agree. I think that the current competence issue is large, and I think that we have to have some way to assess that. Obviously, that's all evolving too. We talk about performance measurement. We talk about outcomes assessment. We're not sure how best to do that. But again, to protect the public and for our own feeling of self-worth, really. I think we have to pursue these endeavors, and again, the specific techniques will have to evolve over a period of time. But I think we're getting a look at what we'll see on the horizon relative to competency as it ties into licensure and things like that.
And preparing the next generation. I know when probably you graduated and I graduated dental school, we thought we knew everything that they had taught us would be the basis for everything that we would do from then on.
Right.
And that soon was sort of revealed that we needed more and more in those areas.
We don't practice the same profession today that we practiced X number of years ago, and that's the way it will always be, I think. And that's one of the things I think that makes dentistry exciting, is not just a technological really explosion, but also the fact that the mix of patients is becoming so complex. Increased longevity, the attendant health problems that our patients bring to our offices, that coupled with the fact that because of prevention primarily, their oral health is improving at the same time, gives us a different outlook on our profession. We practice, again, in a different way. We do things differently, and we do different things.
You have seen the leadership in the profession of dentistry from the local level, from the state level, and then nationally as the president of the American Dental Association. And as I looked at your resume, I was really amazed at the number of activities that you were involved in at the national level, and I know at each of those levels you've really been active. Tell me about the story of Dr. Whiston and his involvement in professional organizations in dentistry.
Well, I think like a lot of us, when you first start in practice, you get involved because of it's the thing to do. It's sort of the next step. You go to a meeting, and if you go to a meeting and repeat that often enough, there are going to be tasks for you to perform. Someone will ask you to do something. And pretty soon, whether it's like quicksand or whether it's just the continual personal drive, you continue to pursue those activities. So I started in Northern Virginia with the Northern Virginia Dental Society and was involved with that at the local level, and then with the specialty groups too, and sort of tracked those in a parallel fashion
Were they
for some time.
parallel? That's what I was curious to see.
For a while, and I was active, again, Northern Virginia Dental Society, and became president of that organization. Also at the same time active with state and regional oral maxillofacial surgery groups. But I think there comes a time when you have to perhaps make choices, and you certainly don't want to try to do everything, and you can't, and it's not in the best interests of the profession, and certainly not in your personal best interest to try to do it all. That's right. So, so early on, I was probably more active in specialty organizations. Virginia Society of Oral Maxillofacial Surgeons, Greater Washington Society, the Middle Atlantic Oral Maxillofacial Surgery Group, and worked with those groups early on. And then at about that time was becoming more involved with dental associations, and felt that it was time to make a decision. And it was pretty obvious early on that the larger arena would be the dental association. When I say that, I primarily mean that from an advocacy standpoint, a legislative standpoint.
The interface with society at large.
Right, yeah, that's exactly right.
Were there any tensions between the specialty and the larger arena of dentistry in terms of any differences or
Well, I think you always see that. I think you always see that. And I think the first task for any specialist in dentistry that chooses to be active in dental association activities or organized dental activities is to remove that specialty hat as early as possible and to the extent that you can possibly do it. That's different in medicine, which is essentially a specialty-driven group. We're a primary care-driven organization or primary care-driven profession. And so for that reason, I think any specialist needs to, and obviously you can't ignore your particular background, but there comes a time when you have to do what's best for the profession. And obviously if it's best for the profession as a whole, it'll be good for the specialty, but the reason for doing it is because it'll be good for patients.
Well, as young people are coming into the profession, what would you advise them in terms of their involvement in their specialty and in the broader profession? How should they get involved? What would be some of the lessons that you've learned?
I think first of all, it's an obligation to do it.
Okay.
I think it's an obligation, and we all can find a different niche, a different level. We can all serve to the extent that we wish. We don't all have to have the either ego drive or personal drive to do a lot in the way of professional involvement, but we can do something. And I think the message that I would send to anyone coming in our profession is that they don't underestimate their abilities. They don't underestimate their ability to be a participant, to be influential to the extent that they desire within the profession. I think it's easier to do than they would possibly imagine. They're obligated to do it. But even putting aside the obligation, it's an exciting thing to do. It's fun, and they should feel comfortable wishing to do those things.
What did you see as some of your the highlights of your time at the ADA, at the Virginia Dental Society, at the local society?
I think when I reflect back on it, there are a lot of specific issues which are difficult issues, difficult challenges, and there are certainly issues which are not so difficult to deal with. But I think the important thing is that if you go to these activities armed with your personal principles, whatever they may be, and it may be patient protection, it may be autonomy for the profession, whatever those issues may be, if you keep those particular principles in mind, then the subtleties, the nuances of the particular issue are not that difficult to address.
So you raise it to a higher level in terms of the basic principles involved. So you can basically look at the variations that may happen from group to group or, you know, individual perspectives.
That's exactly right. With any group, you have the tasks of serving that group and serving the public while you're doing that. But also, as you're discharging your daily tasks, there are certain goals that you can have on the horizon, either short-term, intermediate, long-term, but you can have those goals, and that's what makes it worthwhile. While you're performing the task, you can move inexorably, hopefully, toward those goals.
Well, I'm one of those 140,000 practitioners that watched you through your pathway and had the benefit of your leadership in the many different roles that you played, and you had an amazing ability to create calm when there was a storm and be able to come to consensus in a very positive way. Tell me about your leadership approach and your sort of management approach and philosophy.
Well, and thank you for that. But I think probably the best way, I believe, to lead is to start by listening. And I think that you have to listen carefully. And it's been said that one of the best ways to feign listening is to actually listen. And so I think that's probably the solution to that. And I think another point is that that's been made many times is that you can accomplish a lot if you don't care who gets credit. And I think that's part of it too.
No, I think that's very well said. I wanted to ask you about the specialty area because it is a specialty that walks between dentistry and medicine. It also is a specialty that until recently has not had very many women in it.
Right.
But it probably is one of the specialty areas that is pushing the frontier of dentistry into the more complex patients and what you had just recently described in terms of the demographics that we're looking at.
And a couple comments there on the gender issue first, I think, because it's very interesting. There have been women in oral maxillofacial surgery for many years, some real pioneers, but the numbers, as you say, have not been there. And I think the reason is that I think regardless of what we say about division of labor professionally and domestically,
it's time.
It's difficult. It's difficult. And until the time that that improves, our specialty may be a difficult one in which someone could balance practice and family and children and those obligations. But presently, there's some terrific leadership, certainly from women around the country in our specialty, and I think we'll see more of that. And I think the answer to that is, like the answer to many things, is that it just depends.
Right.
It just depends on what a particular male oral maxillofacial surgeon's interests are, and it just depends what a particular woman's interests are also. So I don't think it's necessarily a situation where we have to segmentalize or categorize according to specialty or according to gender, but I think it will evolve over time. You mentioned the interface. We say and like to say in dentistry that dentistry is healthcare that works.
Right.
And you know, why is it that we can make that statement? Well, first of all, is it legitimate? And I think it is. I think dentistry, for various reasons, is healthcare that really works. The implication in that statement, obviously, is that there's some other aspects of healthcare that don't work so well. But I think there are probably reasons for both those scenarios. On the dental side, we're fortunate. We're a small profession, and because of that, it's probably much easier to have a handle on professional activities.
Right.
But also, we're again a primary care-driven profession. In fact, I think that's one of the basic reasons that, that dentistry does work well. We're not specialist driven. For instance, in medicine, there's about a 20-80 ratio of generalist to specialist. In dentistry, it's close to the opposite. 75 to 80% of generalists in dentistry, and specialists about 25%, let's say. That tends to decrease the fragmentation that we see in our profession. I'm presently the liaison for the American Dental Association to the American Medical Association, and I've been in Chicago this past week at the AMA meeting. And when you're in the American Medical Association's House of Delegates, you can immediately see the inherent fragmentation that is present in the medical profession, not by design particularly. Again, it's just the way the profession has evolved over the years. Yeah. In dentistry, you don't see that. So again, it's a luxury that we have because, again, we're a small profession. We deal with a small area of the body, and because of that, we have that luxury. One of the other points I think we could make, in addition to being primary care driven, is the fact that dentistry has been very cost effective over the years, and there are a lot of reasons for that. But it's interesting that we're able to do that in face of the fact that most dentists practice as solo general practitioners. So when a patient goes to that dental office is essentially equipped, much like a mini surgery center, but they don't triage patients and refer them to various specialists. They take care of most of that patient's needs within that office. The overhead in that office can be 70%, can be over 70%. And those overheads have escalated from the time I started in practice from the 30 to 35% range to that 70% range now. In the face of that escalating overhead, we've still kept costs down. So again, that's a great part of our story. And I think the linchpin to it is the fact that we lead the way in prevention.
I think that definitely is a major gift that we've been able to give the American public, but also it's been given to us as something that we can continue. That's now, right. You have, over your private practice career, probably seen a lot of changes in the practice of oral and maxillofacial surgery. You've also directed departments of dentistry and oral maxillofacial surgery, say at Fairfax Hospital and other hospitals as well. Have you seen changes over the last decades in actually the delivery of care, maybe the financing of care, maybe the regulation of care?
Yes to all of those, essentially. And it's been an interesting phenomenon also. As we discussed earlier, I'm on the board of commissioners of the Joint Commission on Accreditation of Healthcare Organizations, and they are drivers for quality of care, for patient safety, and some of those issues have contributed to the change that you're talking about. For example, as we use perhaps patient safety as a surrogate for quality these days, that raises the bar on the delivery of care. That changes the way we do some things. It forces us to take a closer look at ourselves as we deliver care. It's not enough to say, this procedure seems to work well for me. That's not a legitimate statement. We talk about evidence-based treatment, and certainly I hope we see the day in the not too distant future where that statement, are you practicing evidence-based medicine, evidence-based dentistry, I hope that becomes an insult. We should all be practicing in that way. Science should drive whatever we do. But getting back to the changes, certainly when I first started in practice, for instance in Virginia, seatbelt laws were not, had not been mandated at that point. So we saw a tremendous number of facial injuries for that reason at that time. That's changed over the years.
That's an interesting point.
It has.
So you're seeing a public health issue change in the actual chair in the practice.
Certainly.
The difference
in the same way
the
that if I were a pulmonologist, I would expect or hope that
pollution.
that as smoking decreased, the incidence of lung disease would decrease. But we see that in our specialty, certainly, that there's been change over the years. Certainly technology has been a contributor with implants. What started out as a fairly formidable procedure, the placement of implants, has evolved to the point now where often they're placed immediately following removal of a natural tooth. So things have changed.
Right, and I think, as you mentioned, evidence-based dentistry and medicine, I think there's also been a perception, maybe a misperception of that term, because it seems to some that we are not doing it already. In essence, it's being done to some degree everywhere, but also there's the issue of the patient need and demand that comes into play, and the individual provider's competence in doing it. It goes back to your original point about continuous learning and education. So it's an area, I agree with you, that over time it is going to be a routine part of what we do every day.
Absolutely.
So I wanted to basically ask you, in terms of back to the American Dental Association, what do you see as your vision of the ADA of the future?
I think the ADA of the future will change. Obviously, it's a member organization and should be a member-driven organization, but constituent services, I think, will be the driver of that change. And I think what we may see is more constituent services driven relative to life and place in life for individual practitioners. And I don't think it'll be a cafeteria style membership exactly, but I do think that there will be a recognition of the differing needs that our members have, or that the ADA members have over the years. You mentioned gender issues, diversity issues. We certainly have to, and I believe will, do a better job of reflecting the face of the patients that we care for. And I think the American Dental Association is very cognizant of that issue, trying to do a better job, change the demographics of leadership. Certainly we all look, you mentioned earlier about role models and that sort of thing. Well, everyone needs a role model. And my role model may have been different than your role model and someone else's role model. And so we have to have enough role models in leadership positions so that people will recognize themselves when they look at someone in those positions and desire to achieve the status that that person has achieved. But it's they have to see like images. They have to walk into a room and not be struck by what they don't see. We have to do a better job along those lines, and that will help us, I think, maintain membership. It'll help strengthen the profession over the years. But I think we'll see a more individualistic response.
Well, the tailored approach, I think, is becoming part of business overall, of trying to make it, specific to the individual. But you'd spoken about mentors and role models. What role models come to your mind?
Well, I think when we think of role models,
for yourself,
I think we tend to go back to earlier days. Usually when we think of that, and certainly again, families first, and then you think of certain people over the years that have struck you that you think that they would be people you'd want to emulate. So I think early on there are probably a tremendous number of role models, because life is new, the profession is new, the world is new. But as time goes on, I think still we see role models every day. I think we'll see someone that we think is doing something right, and we say that's admirable, that's the way it should be done.
I like what you said, because oftentimes people think of role models as someone who's senior to them. And probably at a young age that's the case, but as we grow older or more mature, I think we see role models in some of the many younger people around us, and it's the characteristics that sort of you are able to draw out.
That's right, and role models not necessarily in our profession,
right,
but people doing their job or living their life in the right way. And obviously we can all learn every day, and I think we do, but I think that if we don't, then shame on us.
Well, it's sort of the little bit of sort of cherry picking, getting the best from left and right and all around us.
That's right.
You've been a very visible and effective spokesperson on licensure issues and regulatory issues to the House of Representatives and to the Senate. Could you tell me a little bit about those experiences?
They're always interesting, as you know, from a testimony standpoint. It's, you obviously have the message that you want to convey, but also it can change according to the recipients of that message on a particular day, who the senators may be or the members of Congress. But again, we've got a great story to tell. Dentistry has a great story to tell. And so that makes it easier, I think, to deliver the message. It's not often that it's contentious in those situations. It can be stressful, certainly, but it doesn't have to be contentious. And I think, again, because of the good story we have to tell, if we tell it in the right way, scientifically driven, scientifically based, patient-centered, I think we have those basic messages in our mind, then the message itself is not that difficult to deliver. You mentioned the licensure issue, which has been a contentious issue in most professions over the years, but hopefully mutual recognition will continue to evolve to the point that it will not be a difficult issue for our profession. I see in California now, and I believe North Carolina this past week, their legislatures are starting to address this issue and basically allowing for mobility within the profession. It's an obvious need. Dual-income families have to have some flexibility. They have to be mobile, at least have the ability to do that. I think as we see the accreditation process, the accreditation of dental schools, as we see an improvement in that process, an increased confidence in that process, that we'll see accreditation and licensure tied together, hopefully for the benefit, certainly
at the point of graduation, having that first phase done.
Right, for students, and finally for the benefit of patients, because often there'll be distribution issues relative to the profession, which we can affect more readily by increased mobility. And certainly the licensure process is in place to protect the public. That's the reason it's there. But we have to find ways to, again, perhaps merge the accreditation and licensure process to some extent. I think what we cannot afford to do is to drag our feet on these issues. We can't crush the present by invoking the future. We can't say that we'll do these things as minds are changed over a period of time, because I think, again, the public is not...
it's not patient.
Right, and understandably so.
Yeah,
understandably so.
And I think there's enough of these examples, as you said, at the state level where changes are being made and people are able to say it. I wanted to ask how you've been able to do everything that you have accomplished in your career. How have you done it?
Well, I think several reasons. First of all, understanding family, and that's the number one prerequisite, and that's the most important part of the whole thing, because you can't go to dental meetings and not go to games and recitals and things like that. I think we've all heard the expression that no child will remember that you went to a dental meeting, but they may remember if you missed an important event in their lives. So that takes a fair amount of energy, persistence. From a practice standpoint, when I first started in practice, I went in with another person who was practicing oral maxillofacial surgery in Northern Virginia at that time, so that helped. And also it helps when you first start in practice, you're not as busy as you eventually become, so you have time to do some of these things. Now I practice with 2 other people, and without that luxury, I wouldn't be able to do what I do.
So that's a nice way to have a group that's able to cover for them and for you.
Absolutely, absolutely. And you have to do it in a way that is fair from a coverage standpoint, is fair in all respects, so that you don't feel guilty about being away and they don't mind having you away.
Right.
So.
I've also heard that you have a photographic memory. Tell me about that.
Not really. Not really. Not really.
Able to capture things quickly and get things done.
No, I think we all tend to remember things that interest us,
yes,
are important to us. People interest me, and so maybe that makes it easier for me to remember some of those things.
Well, and spatial relations in dentistry and oral surgery. The ADA is undergoing, as you know, a Future of Dentistry project.
Yes.
And looking at all the different areas from research to education to the global issues, licensure, financing. What are some of the things you see in the future of dentistry?
Well, I think there'll be many issues addressed in the Future of Dentistry report, and those will be of more or less interest depending on your personal involvement in the profession. Yeah. But I think the things that, although I was involved intimately with the licensure and regulation chapter, and those things do interest me from a legislative standpoint, from an advocacy standpoint, the things that drive the profession, let's say externally. But I think from an internal standpoint, when I think of the Future of Dentistry report and specifically think of the future of dentistry, what it will look like, I think more of the oral health, systemic health interface, the importance of oral health to general health, the fact that if you're not healthy from an oral standpoint, you're just not healthy. I think those are the things that, some of which will be addressed in the report, but I think those are the things that will be just increasingly exciting as time goes on relative to our profession.
No, those are very important points, and you were a reviewer for the first Surgeon General's report on oral health, and the Surgeon General emphasized those relationships between oral and general health, oral health and well-being. One of the things that was surprising to other health professionals was that those relationships, they were not aware in their training about those relationships. What do you think we can do to help our colleagues understand the value of oral health?
Well, I think that's interesting. Again, when you reflect back historically, there were things that we heard as healthcare tales 50 years ago, which have turned out to be true. We would hear statements that people didn't feel well until they had a particular oral condition treated. Well, it makes eminent sense that that would be true. And if you think about it, and again, you wonder about the interprofessional aspects of that statement, because it's certainly no mystery, and it's not a physiological reach to imagine that the same blood products, for example, that circulate through our heart also circulate through our mouth. And if you think about that, in fact, it's probably all you have to think about to establish the link. But patients certainly understand that. When you talk to patients about why they should do certain things orally because it will benefit their general health, they may not understand initially, but if you develop that theme, for example, they immediately understand it. And we should understand it scientifically also.
Well, I think there's still a lot of work to do to bring the evidence for those that are critical of looking at scientific evidence. But I think you're right about the public. I recall a Dental Cosmos article that had a survey in the 1930s of the public of whether they thought there was a relationship between oral health and general health. And most of them said yes.
Absolutely. It's interesting.
And it's like you said, the stories that you hear from people themselves have always made the connection. But policymakers, what should we say to policymakers about this as well?
Well, I think from a policy standpoint, we have to get their attention specifically relative to funding, for example, and it's critical. If oral health involves 5% of total health, whether it's dollars or whatever it may be, then certainly we should try to get 5% toward research for oral health issues, whatever the percentage may be.
Right.
We have to establish those links. And again, when we present some of those things to legislators, we can make the case scientifically, but in the actual presentation, they're patients, just like we are. And so I think they have to hear these basic stories. When we talk about smoking cessation, for example, should only primary care physicians talk about that, or pulmonologists, or should dentists talk about it? Well, I think as healthcare providers, we should certainly discuss those things. We can tell a patient that if we see changes in their mouth, for example, secondary to their smoking habit, that their lung tissues, their pulmonary tissue are certainly more fragile than the oral tissues. If we recognize those changes so readily, then there's a very good chance that their lungs have changed to a greater degree.
No, it's a very good reinforcement tool. And studies have shown that dentists are as effective or sometimes more effective than physicians in tobacco cessation. I think because of the routinized visits that individuals have to their dentist more often than their physician, and they're a trusted profession.
That's exactly right. And I think as prevention has taken over in dentistry and we've got people in better dental health, they still go to the dentist for that reinforcement and for preventive measures. But while they're there, as you said, it's a wonderful opportunity to talk about health in general, which I believe starts with oral health. We are the window to the digestive system, among other things. It's a great opportunity. And there's a lot of knowledge that's there that I don't want to say it's been missed, because it hasn't been particularly, but the story needs to be told in a better way.
I think you're right about the story being told. And given that we have to tell a story, what about the many young people that are still making a decision of what they want to do with their lives, so they haven't decided whether they're going to go into healthcare or not? And then those that have made a decision to go into dentistry, what would you say to those two groups of young people to attract them into dentistry, and what they should expect to see in the coming career path that they're about to embark on?
I think as a general statement, we tell people and our kids and everyone to follow your dream. Well, I'm not sure that that's something that they can grasp at that time. I think when we were their age, were we able to have a vision that would perhaps lead us to where our dreams, where we thought our dreams might take us? So I think what I would just say about dentistry is that dentistry is a terrific profession, better now than ever, and it's a great place to be. We talked earlier about balancing family and profession. Dentistry is just a wonderful place to be able to do that. And I think that perhaps in years past, when people have thought of dentistry, they've thought of restorative dental procedures and felt that maybe that wasn't quite for them, because as dentists, it does involve a little bit of the art and the science, but we tend to care about small things and technical things, and maybe they couldn't see themselves in that arena. But again, I think as dental health has improved to such a greater extent, and the focus now is more on oral health, they may be able to see themselves in that arena, and they couldn't find a better profession.
Well, I have a few young people for you to speak with in my home.
Be glad to do it.
Yeah, that's great. I was impressed with all the other activities that you've been involved in as well. We talked about the roles that you've had in the hospitals around your practice. You're on the board of visitors of the National Museum of Dentistry, on the board of the National Foundation of Dentistry for the Handicapped, and the board of visitors for the Medical College of Virginia School of Dentistry, and many, many other roles. Again, tell me about these roles and how they fit into your life.
I think they broaden it. I originally got involved in really in organized dental activities on the national level because of location. I practice in Northern Virginia.
Location.
That's exactly right. And as I've said to the person who asked me to get involved that I appreciated and was flattered that I was asked, but I realized that it was because I was a cheap per diem. I could drive to Washington, D.C. and drive home, and it was not a lot of expense for the organization. I understood that role. But I think, again, because of our proximity to the nation's capital, it's easy to appreciate the activity. It's easy to get involved in these things, and I've enjoyed that aspect of it to a great extent. The legislative process. My wife is the executive director of the White House Correspondents Association, and through her work, I also have greater involvement in the legislative process, and that's made a lot of the organized dental activities that much more fun, really.
Yeah, it fits together really well.
Yes, it does. Yeah.
And we're going to be taking the video that we're now having produced to the Museum of Dentistry, so you will be on the board and be able to see the video.
And the museum's a great place, and I know you've been there, but I would certainly encourage anyone to go to the museum. It was a particular honor for me when I was president of the American Dental Association to give Dr. Samuel Harris the ADA's highest award.
Amazing man.
And he is an amazing man, and I really didn't foresee at that time the degree of support that Dr. Harris would give to the museum and to the ADA Health Foundation.
Yes, I just saw that. That's amazing.
Really terrific, really terrific. Yeah.
Well, that's a role model, I'll tell you.
Absolutely.
I mean, when you start taking a look at both a very long life as well as one that continues, a person who continues to give back in many different ways.
He does. He's an amazing individual. I have not gone to Detroit to meet with him. Others have, and they say that he is as punctual and alert as ever and expects you to be the same.
There you go. That's a challenge for some of us. You've had multiple awards, and I just want to mention, from the beginning in terms of in dental school, the OKU Honorary Society and the Psi Omega Scholastic Award, and then, of course, the Presidential Award of Excellence for the Pierre Fauchard Academy, Distinguished Alumni Award in your alma maters, the Albert Bush Award for the Award for the Academy of General Dentistry. These have been distinctions that have been bestowed upon you appropriately, and which of those awards sort of stands out as one that you would like to hold up and say, this is one of my favorite awards? I was very touched by it.
I think when I think of awards, other than OKU, which is in dental school, and that's one that is maybe more directly measured than others. It has to do with the effort that you're putting forth at that time, and I look back on that and really appreciate that. But the others, as I say, that was very measurable, and so not entirely a surprise. The others usually are surprises, and that makes it even nicer, I guess.
Yeah, having that little element of what's around the corner. You had mentioned your wife, who is the executive director of the White House Correspondents Association. Do you want to tell me about your children? Well,
we have children that are spread out across the country, really, from coast to coast, and all wonderfully independent. And we have multiple grandchildren at this point, and they just give us a great deal of pride every day. And I think about another adage, which is you give someone a fish, you feed them for the day, you teach them to fish, you feed them for life, and we've tried to do that.
Well, it sounds like you have spread yourselves out around the country very successfully. Yeah. What does your middle initial A stand for?
Allen.
Allen. Okay.
No particular reason. It's, I'm sure, just a name.
Not a family name.
No, not at all. It just, I guess, a name that my parents thought would fit, and I don't know why.
Well, it has a resonance to it. Balances. What do you do to relax?
I would say, I mentioned earlier, sports, music, reading, that sort of thing, and try to stay a little bit active during the week. Do something some sort of physical activity every other day, go to a meeting like this meeting last week and do nothing for a while and regret it. But tennis, things like that, but also still like to sit down at the piano.
What kind of music do you like?
All kinds, really do, all kinds.
A full range?
Full range, really do.
From classical to jazz and rock and roll?
Yes, all of the above. I think talent is everywhere. There's so much musical talent in the world, and you can walk any street in the city and see that there are just a tremendous number of talented people around. I think you can appreciate that in any particular phase, whether it's, as you say, from classic beyond.
Yeah, I've heard of a musicologist speak once, and he basically said that the music that you've grown up with, you know, your adolescent music to say your early 20s, stays with you the rest of your life.
Yeah.
And I don't know whether it's because we tie it to the images of that time of our lives or
probably so. Yeah, probably so.
Well, is there anything that you would like to say that I haven't asked you about?
No, I think this has been an enjoyable session, and we'll see how it turns out. And you have the power of editing, so you can hopefully we'll get a work product out of all this. It'll be good for the museum. But I've enjoyed it very much, Dashanka. Thank you.
Well, I wanted to thank you on behalf of the International College of Dentists for taking the time. It's been a real honor for me to have had this time to spend with you and get to learn a little bit more than just seeing you on stage. So I appreciate it.
Thank you very, very much. Thank you.
Take care.
Yeah.